Welcome to Joseph Lab Podcast. In today's episode, we will uncover anterior pelvic tilt and its complexities. We will kick off by pinpointing the superficial indicator of the condition, followed by a thorough exploration of its musculoskeletal roots, touching on topics like pelvic subluxation, sacral nutation, and lumbar lordosis. This podcast will elucidate what anterior pelvic tilt is, the diagnostic process involved, and who is susceptible to the condition. Anterior pelvic tilt refers to a muscular imbalance that affects the hip and lower back, causing the pelvis to tilt forward. Overactive hip flexors and lumbar extensors contribute to tight muscles, leading to weakened gluteals and abdominals. These imbalances negatively impact posture and bring forth anterior pelvic tilt symptoms, which include a downward slanting of the pelvis's front, an exaggerated lumbar curve, protruding buttocks, and lower abdominal protrusion. To maintain balance, the upper body may lean forward. Anterior pelvic tilt can influence several muscle groups, such as hip flexors muscles, connecting the pelvis to femur, often tight in individuals with anterior pelvic tilt. Erector spinae, muscles extending along the spine that become tense and overactive to maintain upright posture. Rectus femoris, a quadricep muscle situated on the thigh's front, can tighten under anterior pelvic tilt condition. Gluteus maximus, the largest muscle in the buttocks, can weaken due to anterior pelvic tilt. Hamstring, running along the backside of the thigh, these muscles may weaken and elongate as a consequence of anterior pelvic tilt. Furthermore, lower back muscles like erector spinae and multifidus can become stiff and overactive, while abdominal muscles may weaken and fail to stabilize the pelvis. Before diving into uncorrectable cases of anterior pelvic tilt, it is crucial to learn how to identify whether one has this condition or not. Here are 4 methods to identify anterior pelvic tilt, ordered from the least accurate to most accurate one. Visual self-assessment. Stand sideways in front of the mirror and observe your posture for any sign of anterior pelvic tilt, including downward slanting of pelvis's front, an exaggerated lumbar curve, and protruding buttocks. Wall test. Stand sideways with your back and buttocks against a wall. Then slide your hand palm down between the wall and your lower back. If there's any excessive space between your hand and wall, you may have anterior pelvic tilt. Goniometer measurement. This device measures joint angle and can be used to assess pelvic tilt by placing one arm of the goniometer on the anterior superior iliac spine and the other one the posterior superior iliac spine. A healthcare professional can then measure the angle. Advanced imaging. A study such as X-ray can provide the most accurate visualization of pelvic alignment and tilt, enabling healthcare professionals to definitively diagnose anterior pelvic tilt. While preliminary methods like self-assessment can give you general ideas, consulting a medical professional is essential to properly diagnosing anterior pelvic tilt. Most healthcare professionals refer to anterior pelvic tilt as lower cross syndrome, which can eventually lead to upper cross syndrome. This topic will be covered in upcoming videos. With around 80 possible pelvic subluxation variants due to the irregular sacroiliac joints and the pelvis's innate forward tilt, this minor pelvic tilt serves to strengthen the lumbar spine and resist forces during the basic motions like walking, jogging, or running. Consequently, a slight tilt is typically benign. However, when the ilium becomes fixed and prevents any changes in its orientation related to the sacrum, anterior pelvic tilt or lower cross syndrome can develop. This may stem from an externally subluxated ilium, a posterior and inferiorly subluxated ilium, or a posterior, inferior, and externally subluxated ilium. Such subluxation lead to anterior pelvic tilt / lower cross syndrome by prompting nutation where the sacrum's base angle shift exceedingly forward, akin to the ASIS and PSIS angles. Pelvic subluxation of this nature force the body acclimatized to misalignment, causing weakened and tightened muscles such as previously mentioned. As a result, muscles become abnormally lengthened or shortened. It is vital for patients to engage in targeted exercise to correct these imbalances. Almost everyone benefits from tailored exercise for their weakness and strength. Now let's discuss prevention. To ward off anterior pelvic tilt, engaging in combination of exercise, stretching, and proper posture, consider these tips. Fortify core, lower back, gluteal, and hamstring muscles to stabilize the pelvis. Stretch hip flexors and quadriceps to relieve the muscle tightness, contributing to anterior pelvic tilt. Optimize posture by sitting, standing upright while engaging core muscles. Interrupt prolonged sitting and standing with regular movement intervals, alternating between positions when feasible. Explore ergonomic sitting and support solutions to promote correct spinal alignment and posture. While implementing these tips may improve muscle imbalances and stave off anterior pelvic tilt. Consult a qualified healthcare professional if you are already experiencing anterior pelvic tilt for further evaluation and treatment. Comprehending the surface level and musculoskeletal triggers of anterior pelvic tilt empowers you to make informed decisions to enhance your posture and holistic health. Seek professional guidance when necessary, and employ preventive measures to thwart the onset of anterior pelvic tilt. Stay tuned for future episodes that delve deeper into preventive measures and exercises to both curb and address pre-existing anterior pelvic tilt. I hope this information is helpful.